Very good evening, one and all. This is Dr. Vijay Kumar Chennamchetty, CCI Webinar Coordinator. Today, it's an absolute honor for me to moderate today's session on air pollution and its impact on public health, lung health, on the eve of World Lung Day. This year, the World Lung Day theme is very clear: healthy lungs for a happy life. So, without any further delay, the plan would be today is the flow of the webinar would be, okay, first I would introduce my esteemed panel. And there are two talks, my dear friends. Okay, the talk will be on, first I will be delivering a talk approximately of 15 to 20 minutes. And then that will be on air pollution, currents, epidemiology, and also its impact in life or health overall. And the second talk would be by none other than Dr. Kirat Kaur Sibia, okay, from Ludhiana. And she will be speaking on what are the take-homes that we can implement in India in the current case scenarios where there's a huge pollution in majority of the cities, particularly out of 20 cities globally, which ranks worst polluted cities, 18 cities are from India. So sometime back, Beijing, New York, San Francisco, and London, okay, many other cities were very worstly affected with air pollution. And then she is going to talk on how to revive, how to repair, and how to restore such a cities into a breathable cities. So that will be the talk from Dr. Kirat. And we have a Bijal, can you please play the slide? We have some sad news. Okay. Dr. Suprava Chakraborty, who's a life member of CCI from Ranchi. Okay. She lost her father, Shyamal Chakraborty. Okay. I request everyone to pay silence for 1 minute and to pray that his soul would reach Lord Venkateshwara or Almighty. Okay. So I request everyone to be silent for next 1 minute till I say so. Thank you, everyone. Okay. So I would love to introduce my wonderful panel here. So first of all, Dr. Renish Bhai. Renish Bhai has got a wonderful CV. Okay, if I go through the CV, it takes another 1 hour or webinar time will be done. So without, okay, and I'm sure everyone in CCI and across India pulmonology knows about Dr. Renise Davis. And I'm sorry, the family name is very tongue twister, sir. My apologies, I couldn't read. So, sir is a professor and head of the department at Amala Institute of Medical Sciences, Thrissur, Kerala. And we have a guest physiologist and a very good, strong supporter of CCI, Dr. Kavana ma'am from Haveri. So she has got again, a brilliant achievements, lot of fellowships, lot of diploma, lot of certifications. Ma'am, we are absolutely honored to have you here to discuss today's hot topic, ma'am. Thank you so much. Welcome on board. And my great friend, and I can say my cheddi dost, because it is being almost 20 plus years, we know each other. Okay, Dr. Jairaman, we were together at Apollo Chennai during our post-graduation days. So Jay, always the dedication that you show for academics is absolutely amazing. He is at least working at many institutes, but predominantly at MGM. He is academic chair there, and then he works with Apollo First Med. He works with Bill Roth. Okay, you name any very good hospital in Chennai. Okay, there is some imprint of Jayaraman will be there. Okay, we are honored to have you, Jay, with us. And Ankit Bhai from Jaipur. Okay, Ankit Bhai is currently senior consultant, and it is Dr. Atri who and then me, we pulled Dr. Ankit into this, despite there is some some small but significant hardships that is going on health front in the family. So to father, right? Yes, right. So we sincerely pray that uncle will get well soon, and Ankit Bhai is doing a phenomenal work for breathable air across India. So he is running a lot of campaigns. We are really truly proud to have you on board, Ankit Bhai, and he is the current director of Anik Healthcare Solutions Private Limited, and again very big CV. Pardon me, right? And Kirat Kausibia, okay, a wonderful personality, okay, and good friend, and she made so much impact in the CCI webinar group, and then from Ludhiana, okay, Kirat, really, proud to have you on board. So looking forward for all your inputs today. So I think I have covered everyone. So let me share my screen to present my presentation. Hope my screen is visible.
Yeah, visible.
Yes, yes. And slides are moving. Right. So I know I may cross some time. If I'm crossing too much time beyond 18, 19 minutes, please alert someone. So, to next 15 to 20 minutes, I'll be speaking on air pollution and its impact on human health. And thank you, Dr. Atri, and then Krishna Anna for giving me such a wonderful honor of moderation today, and also making me present the key concept in the form of a presentation. So we all must be aware. If not aware, at least through this webinar, please get aware. So what is the worst thing that has happened after industrialization? After industrialization way back in 1952 in London, there's a great thing called what has happened is Great Smog of London. So this has happened in 1952 from December 5th to December 9th during winter season. And then what is the reason behind this? A cold weather inversion trapped a lot of pollutants from the coal burning from various factories, various power plants and fireplaces and near ground level. And this pollutant mix was consisting of a lot of sulfur dioxide, smoke and acid particles. And the visibility in London, the great city of London, has got collapsed just to few feet. And even ambulances had to stop running. The city went to complete shutdown, and offices, schools, public events were completely disrupted. And there is a health disaster that has happened because of this great smog. What has happened was the schools, offices, everything was shut down, and patients started, or even the healthy people started suffering with a lot of respiratory ailments, respiratory distresses, ARDS, pneumonia, bronchitis. The death toll just because of this 4-5 days of great smog was close to around 12,000 deaths and close to around 100,000 illnesses that was reported way back in 1952, which was a very, very huge amount. And cattle at Smithfield Market choked to death because of the smog. Government went into shock. Initially, they haven't realized. Later, by the time they realized, a lot of morbidity has happened. And ultimately, this has led to a lot of public awareness. And then followed by, the UK government has brought this act of Clean Air Act of 1956, which introduced smokeless fuels and reshaped urban air policy worldwide later on. And what is the global mortality burden because of air pollution? All-cause mortality was close to around 8.51 million deaths per year. Combined ambient plus household, is 6.7 million deaths per year as per WHO fact sheet. And outdoor pollution alone would contribute around 4.2 million deaths per year. And children under 5, as per the 2021 data, almost 7 lakh children are under the age of 5 years are dying because of air pollution. And Indian mortality burden, if you see, deaths due to long-term exposure between 2009 and 2019, almost 1.5 million deaths per year. Deaths attributed to air pollution, 1.67 million deaths. Premature deaths annually, and that is recent estimate says almost 20 million people dying per year. And deaths attributable to outdoor ambient pollution as per 2019 is close to 1 million deaths. That is 10.4% of all deaths in India is happening just because of outdoor air pollution. This is not what is my numbers. This is numbers from the data which is available in the internet. Coming to air quality index, what is this air quality index? If you see what has happened during the Great Smog of London, which consists of a lot of sulfur dioxide, and then the permissible levels during the bad pollution days is 100 to 200 microgram per meter cube, whereas it went to 1500 to 2000 microgram per meter cube. Particulate matter, which was normal is 15 microgram per meter cube, it rose to almost 5000 microgram per meter cube. And those days during the 1952, the air quality index was not available. When we calculate with the available data, the air quality index, would rise to almost 1500, which is almost non-breathable. It is highly toxic to humans and other living beings. So when we look at the graph, the WHO safe limit is 15 microgram per meter cube. In the Delhi, the worst days we can expect 900, and the AQ greater than 500 is what is really hazardous to human population and other living beings. Whereas during the London smog, it went to 1500 closely. And this is the AQI classification where 0 to 50 is good, and then 51 to 100. So it can cause some breathing discomfort in sensitive individuals. 100 to 200. So the breathing discomfort can be occur with lung and heart disease, particularly children and elderly people. 201 to 300 up to 300. The quality is poor quality, and then it can cause breathing discomfort to most who get prolonged exposure. Up to 400, very poor standards. Serious issues can occur in patients with heart and lung disease. Up to 500, which is severe category. So it can affect healthy people, which can cause serious impact on healthy individuals as well. So what is the pathogenesis if you see? If you see air pollutant exposure, which consists of particulate material, PM 2.5 and then 10, ozone, nitrous oxide, sulfur dioxide, and other organic, volatile organic chemicals, metals, which are circulating in the ambient air pollution. They cause a lot of epithelial injury, oxidative stress, and affect the activation of innate immune responses, leading to a lot of chemokine release and cytokine release, and the recruitment of neutrophils, macrophages, and other inflammatory cells into the exposed cells, particularly lung, which eventually leads to chronic inflammation and airway remodeling, lead to a lot of hyperreactive airway disease. On chronic exposure, it can make susceptible individuals into asthmatic and COPD patients as well. So this is what a pictorial representation, whereupon exposure to particulate material, lot of inflammation leading to lot of chemokines, lot of inflammatory cell recruitment, leading to oxidative stress, decreased antioxidant activity, increased lipid peroxidation, leading to a lot of inflammatory pathways activation because of this reactive oxygen species. And upon this chronic activation, what will happen is, okay, there is a lot of endothelial dysfunction and oxidative stress happen. This leads to not only inflammation in the lungs, but also these inflammatory mediators, they circulate in the lungs and causes chronic systemic inflammation, leading to atherosclerosis, ischemic heart disease, can lead to stroke, hypertension, diabetes, metabolic syndrome, and neurodysfunction, that is new because of chronic neural inflammation. And this is another pictorial representation where the pulmonary inflammation, upon chronic presence of this pulmonary inflammation, can lead to neuroendocrine imbalance, direct translocation, biological intermediates, which leads to lot of other systemic and then vascular side effects that includes end organ damage sometimes. So let us look at what is happening in the Delhi. So Delhi's deadly cocktail consists of lot of pollutants which release from industrial tract, aircraft emission, road dust, agricultural soil dust, and lot of domestic and garbage burning, and then agriculture things, residues. This leads to a lot of deadly cocktail, which consists of vehicular emissions as mentioned, and crop residue burning, industrial pollution, construction dust, domestic fuel, geography and weather related things, waste burning also can lead to this pollution. So let's look at, if I mention about pollution in Delhi, and if I don't mention in South, that is about number Bangalore, that is our own Bangalore. If you see, the percentage of city covered with vegetation in early 70s were more than 68%. The graph very clearly shows the pictorial representation of Bangalore city shows very clearly. But unfortunately, by 2021, if you see, less than 3% of the Bangalore city is covered with vegetation. How pathetic system that has been evolved. The modernization led to complete lack of vegetation from 68% in 70s to 3% as of today. So I have to talk about Hyderabad. This is the city where I live in. So This is the picture where few decades back Hyderabad looks like, some centuries back, 1 century back, okay, Charminar area looks like. There is no other construction in and around Charminar. A lot of greenery was seen. But can you please assume, okay, this is the level of constructions. If you see, probably you can think that we probably living in United States of America, one of the best city kind of thing. But these pictures, okay, are taken from Hyderabad, okay, and complete lack of greenery. So where are we heading? What are we giving to our future generation? It's a big question mark. So natural source of air pollution, if you see, the number one cause when before industrialization was volcanic eruptions, wildfires, followed by and then dust storms, sea salt spray from oceans, pollen and mold spores from plants, and decomposing organic matter. These were the predominant cause of natural cause of air pollution, but they play a minute role in today's 2025. And coming to indoor pollution, I should mention about indoor pollution, without which the talk is not complete. So it is indoor air pollution refers to contamination of indoor air from various sources. The major sources are household fuel and combustion, building and environmental factors, consumer products, and like pesticides, cleaning products, air fresheners, tobacco smoke, and mosquito repellents, these kind of things. Modern sources like gas stoves, heaters, electronic devices, and printers, these are all contribute to indoor air pollutions. They directly affect the respiratory, cardiovascular, perinatal, and other system effects. And as per the global burden, WHO estimates 3.2 million premature deaths annually due to indoor air pollution, major burden in women and children, because they are the one, who get exposed in the indoor for longer duration. How to prevent? So we'll discuss these things in the panel discussion, but swiftly speaking, cleaner fuels and technology, ventilation improvements, that is cross ventilation, using exhaust fans, kitchen hoods, separate cooking areas from living or sleeping rooms, and household practice like avoid indoor smoking, avoid agarbattis usage in the indoor, or mosquito repellents, because each mosquito coil burnt in a closed room would be equal to roughly around more than 100 cigarettes smoked. So avoiding that mosquito coil burning in a closed room is very, very important. And more importantly, policy and public health measures, which we will discuss in the panel discussion. Smoking, which is very, very important. Another couple of slides on smoking. So health risks of smoking includes, we all know about smoking can cause systemic inflammation, leading to cardiovascular disease, cancers, and chronic COPD, chronic obstructive pulmonary disease. Reproductive and pregnancy risks exist, and other effects like it weakens immune system, and it weakens the cognitive ability, and it can contribute to development of diabetes and early aging and dental issues as well. Important thing what I want to stress is second-hand smoke. It also called as passive smoking or environmental tobacco smoke. It contains as equal to as lot of chemicals that get exposed in those who are smoking. Okay, even the persons who get exposed to second hand smoke, they are equally getting exposed to 7,000 plus chemicals, including 70 plus known carcinogens. And the predominant ones include the irritants are nicotine, carbon monoxide, formaldehyde, benzene, ammonia, and arsenic and heavy metals. So very, very important thing in terms of global burden. In 2019, 25.3% of middle and high school students reported to have secondhand smoke exposure in their home. That is 6.7 million, and which can cause premature death of 41,000 adults and more than 400 infants each year. What is third-hand smoke? Third-hand smoke refers to persistent particulate matter that becomes embedded in environments exposed to cigarette smoke even after smoke has cleared from the air. So this also plays a very, very important role in a lot of pathogenesis. It is very, very important. Those who doesn't move with smokers, those who doesn't smoke also, they get exposed, they get the risks from third-hand smoke. And health risks include, lung cancer, heart disease, and other chronic issues like CVAs, bronchitis, COPD. And in infants, there is a chance of infant death syndrome, and more likely in pregnant women, this can lead to premature deliveries, preterm birth, and other developmental problems as well. And very, very important to note that the benefits of quitting smoking is they start within 20 minutes. The heart rate and BP, they tend to drop in 20 minutes. Within 12 hours, carbon monoxide levels in the blood normalize. 2 to 12 weeks, circulation and lung function starts to improve. 1 year, the risk of heart disease halves. 10 years, risk of lung cancer cut to half that of a smoker. 15 years, risk of coronary heart disease is similar to that of a non-smoker. This is the very, very important news. So look at the impact of the air pollution. Then Taj Mahal and current Taj Mahal, the impact of acid rains has taken away the beauty of Taj Mahal. And we are one great initiative that is happening in Hyderabad is Hydra. This Hydra is something which is doing a lot of taken an initiative of reclaiming the encroached government land and assets, lake revival system. That is very, very important thing in terms of pollution. Probably these are the measures which are going to increase the number of plantations, number of vegetations in Hyderabad. And once the lake revival system, the flooding will be controlled. And proudly say that our Chief Minister Revanth Reddy and also the Hydra Commissioner Mr. Avul Ranganath, IPS officer, they are doing a phenomenal job. And then this has led, at least this year, because they are doing this Hydra for the past 1.5 years, at least this year, the over flooding of a lot of areas in Hyderabad have become very, very negligible. And with this, I would love to hand over my mic to Dr. Kirat for her talk. Thank you.
Very good evening, everyone. I am Dr. Kirat Sibia, your friend from the CCI family, and I'm very happy to be here with you today on the event of World Lung Day webinar, thanks to Dr. Krishna's vision and Dr. Atri's active pursuit of this topic. So after the brilliant presentation by none other than our master moderator, Dr. Vijay Kumar Chinam Chetty sir, I'm going to be talking about global models that India can't afford to ignore. Basically, countries and cities which have done very well and gone from smog to solutions, they are going to be our guiding light. So why we need to talk about this? Let's have a quick look at this list of countries which are doing very well and doing very poorly. On the left, you have the most polluted top 10, and on the right, you have the top 10 cleanest air countries having the best AQI and versus the ones which have the worst AQI. So what we notice here is that the top 10 have AQIs upwards of 50 or 100, and the top cleanest have AQI which is less than 25. Why we need to talk about this? Why we need to talk about air pollution today more than ever is because when we look at the risk factors and for the global deaths, you'll see that air pollution is second only to high blood pressure. It is the largest cause of mortality, second only to high blood pressure. When we talk about India, let us talk about the Indian subcontinent and look at our neighbors as well. So India has an average AQI of 110. Pakistan is doing little worse, that's 115. Bangladesh doing even more poorly, 140 AQI. Nepal also not doing too great, AQI is 150 to 200. Bhutan doing better, doing well. Small pocket, AQI 60. So this is a concern for us because not only we are polluting our own air, but our neighbors are also doing a good job of polluting the air, and they are also going to increase our challenge. India faces severe air pollution with many cities consistently ranking amongst the most polluted globally. So if you look at the top 10 most polluted cities in the world, 6 to 9, this is how it fluctuates. 6 to 9 out of the top 10 most polluted cities, they are in India. I mean, it is actually unfortunate fact. WHO recommends a PM 2.5 level of 10 microgram per meter cube, but in India, it's 10 times higher. That are the levels which are reported. And the major sources are vehicular emissions, industrial discharges, and construction dust. We must understand what are the causes because only then remedial actions can be taken. So why we want to look at the other countries who are doing well, cities which have done well? Because first, it gives us hope. Second, it shows that it is possible to make a difference. These cities and countries have successfully implemented strategies to improve air quality. And if they can do it, we can also. I am going to be talking about the Beijing model in detail. And we are going to have an analysis of their air quality improvement strategies. So Beijing's success in air pollution control has been hailed by the UN Environment Program. Over the past decade, Beijing has achieved a reduction in their PM 2.5 levels by more than 50%. And they have been able to move from good air quality days from 176 days to more than 300 days over the past decade. And here are the key features of the Beijing AQI regulation strategy. First of all, industrial regulation. So Beijing, what they saw, there was closure of polluting industries. Thousands of coal-fired boilers and factories were shut down or relocated outside urban areas. And they upgraded emission standards. Industries were mandated to adopt cleaner technologies, reduce sulfur dioxide and nitrogen oxides. Second, transportation reform. Beijing introduced some of the world's strictest vehicle emission standards, which are comparable to Euro 6. They promoted electric vehicles with more than 5 lakh electric vehicles being deployed with widespread charging infrastructure. Also, they went in for traffic restrictions, measures like alternating license plate restrictions and expanding public transit. With this reduced vehicular emissions, somewhat like the odd even rule which was brought in Delhi, mostly to discourage people from using their private vehicle and to encourage use of public transport. Next, they changed their reliance in terms of energy with transition from the non-renewable to renewable sources. First, there was coal to gas conversion. More than 20 billion was invested in switching residential heating and power generation from coal to natural gas. And there was adoption of solar and wind energy in neighboring provinces as well to reduce their reliance on coal. They were very aggressive with their urban green initiatives, like deforestation projects. Beijing planted millions of trees, creating urban forests to absorb pollutants. And also they deployed dust control measures, stricter measures on construction activities to limit airborne particulates. They actually overfilled their 1 million MU, that is like 66,000, about 66,000 hectares afforestation goal, with larger green spaces, including river parks and botanical gardens, which have been created over the past decade. Forest coverage reached an all-time high of 44.8%, and green development became a defining feature of the capital. All this was supported by legal and policy framework. All critical decisions concerning planning of the capital mandated to be submitted to the Central Planning Committee for approval. Resolute measures were taken to rectify problems in fields of planning and natural resources to uphold the authority of city planning in keeping up with pollution control targets. Beijing launched several iterations of its Clean Air Action Plan with set targets for pollution reduction and clear milestones for PM 2.5, nitrogen oxide, and sulfur dioxide reductions. China's Environmental Protection Law and Air Pollution Prevention and Control Law empowered local governments to enforce stricter measures. The local governments became more accountable to the central control, and the local bureaucracy became accountable for the measures which were to be taken. There were heavy penalties for industries and individuals violating emission standards. And these penalties were on a daily basis. So say if someone is violating the emission standard for 1 day, 2 days, the fine is going to pile up. Already the fine being very heavy, and on top of it, the fine piling up was a great deterrent in people actually even thinking that they can afford to pollute. Along with this, there was deployment of air quality monitoring systems and real-time data transparency, so that comprehensive air quality monitoring and public reporting go together. Community education and engagement and education programs were very much a part, because the community has to come together and take ownership of the clean air that they think they deserve or is their right. Along with this, encouraging public ownership and reporting of issues, efficient readdressal of community calls, and swift response to public complaints was ensured. Because only then the public or the community can have faith in the system that if they make a complaint, things will turn around and action will be taken. So what's our role as flag bearers of pulmonology and concerned citizens? It is to generate government commitment. So because we do need strong political will, and we can do that if we start campaigning for action for clean air, and we must raise public awareness. People must understand that if they want clear blue skies, if they want good air to breathe, then they have to take some action at their own level, and communities have to come together. So in the end, I would like to share this very interesting thought. So you must have heard that one must imagine Sisyphus happy. I think it's very apt in this particular situation, because if at the background, if you see, Sisyphus was a Greek mythological character and who was in the underworld, and he was cursed to eternally roll up a boulder up the hill, only for the boulder to roll down again. So there are two ways of looking at it. One would be that it is a futile action. Sisyphus is rolling the boulder up the hill. It's only going to fall down and come back, roll down again. And the other is that this is a saga of resilience and perseverance. Sisyphus is happy. He's doing what needs to be done. And we must do what needs to be done. Thank you so much. Now over to our master moderator, Dr. Vijay Kumar Chanamchetty sir, to further take up the proceedings.
Kirat, first of all, let me appreciate you for a brilliant talk. Okay, it's a very informative talk. And then the analogy, the last slide which you have brought, that Sisyphus analogy. So we should ensure that the boulder is, carried, to till top, and then ensure that our all collective efforts will succeed. If Beijing succeed, if San Francisco succeeded in combating air pollution, why can't we? There's a lot of information, lot of take homes from your talk. So, of course, let's discuss soon, point by point. So, I thoroughly enjoyed, Kirat, your talk. So, welcome once again, all dear panel, and I'm sure there are hundreds of people who are listening to us across the subcontinent, and of course, nowadays our webinars are really famous in Southeast Asian region. Nepal people are watching, and Sri Lankan people are watching, and other countries, few other countries also. It is getting telecasted. I'm sure. Okay. Any questions, my dear friends? If you have concerns, if you want to give some inputs, how to combat air pollution, do not hesitate. Just post your suggestion, post your question. We'll be happy to take your question. And in the panel discussion for next 1 hour or 1 hour 15 minutes, okay, I have designed it as 5 rounds to all the panelists. So first round consists of regarding public health policies and setting the context. So Dr. Kavana, okay, and how do you see air pollution influencing the rising incidence of respiratory diseases in India?
First of all, very good evening, everyone. Thank you, Vijay sir. So actually, if we are speaking about the air pollution in India, if I say, because air pollution, it's mostly responsible for 50% of the COPD DALYs, we say, that is disability adjusted life years. And even in your talk, sir, like you also highlighted on how Nama Bengaluru by 2021, the way there is less than 3% of the total vegetation is being occupied. Definitely, air pollution is nowadays, it's seen like an increasingly not just as a trigger factor for asthma and COPD, we also see it as a main driving force that is causing the rising incidence of asthma and COPD, mainly because of the factors of particulate matters, which is also been highlighted in the second presentation by Dr. Kirat, where the particulate matters was, the mean content was about 15 microgram per cubic meter, is being raised to 4,000 to 5,000. Definitely all these particulate matters, nitrogen oxides, sulfur oxides, ozone, these are all is going to cause the inflammation as well as the oxidative stress. Thereby, it's making the bronchial hyperactivity more, the airways become more sensitive and it's going to impair the. So, in life, like during infancy or during a child, it's going to be very harmful, sir.
Right. Thank you, Dr. Kavana.
So, definitely, I can say this influences.
Somehow, I'm
Yes,
getting
sir.
tracking from your voice. Is that for everyone? Dr.
Yes,
Kiran?
Vijay, yeah. Some voices, yeah.
Some voice tracking is there, ma'am. Please ensure that you don't have any other devices accessing your Wi-Fi so that your network will be very good. The very valid inputs is, okay, chronic exposure to these air pollutants, particulate matters really matters most for lung patients. It matters most, and these things on chronic exposure leading to acute exposure lead to hyperreactive airway disease, chronic exposure turning them into asthma and COPD. And well taken your points, ma'am. And Dr. Ankit, what role does the healthcare professionals have in influencing air quality policies, ma'am? Having been in so many social forums, I'm sure you have had enough experience. Can you please share that data?
At the outset, I would like to thank Dr. Anish Krishna sir for giving me the opportunity and by wonderful moderation by you. So, talking about healthcare per se, they have a very unique and a powerful role because they bridge the science, the patient care, and public advocacy. So, where we find their role could be like that they could be included in clinical evidence and research. That is, they can document and publish the health impacts of poor air quality. They can conduct the various epidemiological studies. The second point is patient advocacy. That is, they can educate the patients and family about the risk of air pollution and preventive strategies like applying masks or using avoiding outdoor exposures like that. Similarly, a healthcare provider has a very key role in policy engagement because he provides the expert testimony in legislative hearings or public consultations. So he can combine with the government agencies, NGOs, and community organizers, particularly for the health consequences of pollution. Besides this, he has a very key role in public awareness and communication so that it is not only an environmental issue, it becomes an health issue so that it is taken as a priority. So in its institutes only, he can take as a leadership role in which he can encourage the hospitals and health system to adopt clean energy and reduce emissions. So he can be a role model in many things. So healthcare role, if we see per se, as a very important role in combat this particular fight for clean air.
Brilliantly put. Okay, what Dr. Ankit is mentioning here is you can be very wonderful pulmonologist, but unless you take initiative in bringing the impact of air pollution down to lesser level, you can't be called as a national hero. So I'm sure I have listened from the national hero, Dr. Ankit. Okay, absolutely brilliant points. I made a note of these points for conclusion as well. So, Dr. Kirat, yes, I have some partiality towards you. So that's why I'm first coming to you. So, what do you think the latest scientific evidence linking air pollution with cardiovascular and neurological disease? So I'm sure I have covered a little bit. I would love to hear from you.
So this is a very, very valid question because we must think beyond lungs, but because quality of life is affected if any other system is affected by air pollution. Now, the thing is, when we talk about cardiovascular system, there is more and more evidence which is linking air pollution and the damage it causes to the cardiovascular system and the neurological system. And the mechanism, even though it could be that the particulate matters 2.5, 2.10, PM10, PM2.5, nitrogen oxide, sulfur dioxide, and ozone, they can trigger cardiovascular events. And there's an increased risk of cardiovascular events like a heart attack, strokes, or arrhythmias due to continued exposure to air pollution. And when we talk about the neurological aspect, cognitive disability is accelerated with exposure to air pollution, which also is kind of extrapolating to and has been linked with evidence to Alzheimer's, to dementia, and to Parkinson's. Basically, there is oxidative stress, there is inflammation, there is endothelial damage and dysfunction, which is leading to this prolonged, slow prolonged exposure, leading to continued damage. And also in case of CNS, there is damage to the blood-brain barrier. So all these pollutants are actually able to reach the CNS and damage it further. Come to think of it, sir, it's become more and more common to see young people with strokes, young people with heart attacks, even people who are, visibly or seemingly fit, people who have good capacity, going to the gyms, also working out. So many gym deaths also we are hearing. Suddenly it has come up in the past 5-10 years. So this is a trend, and I think we need to see if this could also be attributable to air pollution because we're all breathing the same air.
Right. Absolutely brilliantly put. See, our strength of India is out of 1.4 billion people, close to 60-65% of people are very young, the age between around 20 to 45 or something, very productive age. If they get affected with a lot of systemic diseases like non-communicable diseases like CAD, CVAs, naturally our strength is becoming into weakness because the productive age, at this productive age, they need a lot of support to build this nation. So it is very, very important, my dear young people who are listening, apart from, doctors, whoever the public is listening, please ensure that you are protected from air pollution. Ensure that whenever you are bound to travel, bound to be in highly polluted times with the air quality index above 100, particularly wear a mask. That is a simple measure is going to prevent the particulate material get trapped into your systemic circulation, and thereby, once it is reduced exposure, then the reduced side effects and reduced systemic side effects. Thank you, Kirat. Jay. And yes, we now want you to give some inputs as an astrologer. Okay. How do you see India's lung health 20 years from now if pollution continues unhacked? I think Jay's answer would be he will make his son and daughter pulmonologists, his grandson and daughters into pulmonologists, so that they can, they can make good practice. Over to Jay.
Thank you, Vijay. Good evening to one and all. First of all, I thank you, Chess Council of India, Krishnaji, and all the leaders of our Chess Council of India, Dr. Shivani, Atri, Ravi Dosi, and Ashish Dubey, and all the leaders, Anil Maske, all the leaders. And Vijay, you did a wonderful presentation, 18 minutes of a beautiful presentation of various, London smog, 1952, and so many things. And Kirat also did nicely presented about all the current scenario of various cities and etc. So really enjoyed a lot of take-home points. So coming to the question, if you don't control the air pollution in a proper manner, so what will happen? As an astrologist's perspective, the predicted cause of mortality, already WHO released 15 years before, 2020, that is 2000 and 2030. What are diseases increases in 2030? So as per the WHO prediction, if you take the top 10 causes of mortality, already there are 4 major respiratory diseases causing top 10 causes of mortality, mainly the COPD, lung cancer, pneumonia due to various virus, bacteria, and tuberculosis. These 4 already taking part in the leading cause of death. So these all the diseases are because of the environmental pollution, air pollution main culprit behind that. If you don't control the air pollution menace in a particular way, if you don't implement a proper strict law enforcement like Beijing model and etc., so all the diseases will double. We'll see a lot of lung attack due to COPD exacerbation, ILD exacerbation, and the asthma triggering factors due to the air pollution. Lung cancer, if you take lung cancer, global scenario, the number 1 cancer in the world. Indian scenario, head and neck cancers are number 1 cancer. But very soon, because of the air pollution, it may replace the lung cancer. Because of the air pollution will lead to lot of morbidity and mortality. So as per WHO and the other great agencies very clearly tell about that, in due course, the lot of already, if you take the OPD cases, respiratory diseases are the lot of problems we are facing: asthma, bronchitis, infections, pneumonia, etc., all because of the immunosuppressants, air pollution, etc. So definitely the disease will be double, triple, quadruple. There is no doubt if you don't take a proper action through individual, as a society level, and the corporate level, as well as the NGO level. NGOs means mainly the lot of organizations, non-governmental organizations like Rotary, Rotaract, and the Lions Club and Indian Medical Association. There are a lot of associations and government organizations. If we don't take proper thing, the respiratory diseases will triple, quadruple, and we face a lot of lung attacks. So this is my take on as per WHO prediction.
Thank you, Jay. That's a wonderful thing. Coming to boss, okay, Renee's boss. Okay, please show some light on, see, if I'm asking to Jay and Ankit, they are attributing, even if I'm sneezing today, they are attributing to air pollution. And then if I see a patient in a OPD with lung cancer, he's a non-smoker, they're attributing to air pollution. Do you think, is that correct? And then what is the exact current burden of chronic lung disease in India, and what are the key contributing factors? Is air pollution is also a contributory factor?
Yeah, good evening all. It's a wonderful family CCI here, around 1500 login. I am surprised to see this much of people here, and good evening to all. And thanks, Dr. Vijay, for inviting me as a panelist, and your wonderful question for which I have actually referred your own Times of India news, quoting around 39.5% of the disability adjusted life years are due to this air pollution. And also, I am surprised to see 1.8 million dying last year due to air pollution, attributed to air pollution due to different diseases like stroke or heart diseases, the COPD, respiratory infections, etc., etc. So if you look into the cancer, as Dr. Jairam was telling, I think the numbers in India have increased from 63,000 to around 83,000, around 20,000 rise for the last 10 years per year incidence of lung cancer I'm quoting in India. So there should be some, contributing factors. If it's only 40% from air pollution, we have to think about the other contributing factors, maybe the indoor pollution. You have to extrapolate to the smoking factors, maybe active, the secondhand smoke, passive smoking, etc. And also the socioeconomic status may contribute, because the way they can approach an healthcare facility, how much they are educated, and how much they are having before they come out to the world, how much the exposure they are getting in a utero, and contributing to poor lung development. All these are contributing factors, what I feel, Dr. Vijay.
Oh, so I completely agree with you, every point, Dr. Rennis. So it is multifactorial, but ultimately, so when we look back, okay, probably when we were in medical school 25, 30 years back, so whatever case we have seen lung cancer, ultimately it used to occur only in smokers. But now in 2.5 decades, 3 decades, the scenario has completely changed. More often we're seeing in patients who are non-smokers as well. Probably one factor would be pollution. I agree with you. And now, can I take the opinion of Dr. Kavana? Okay. Ma'am, are children more vulnerable than adults to air pollution? And if it's so, why?
Yes, sir. Children definitely they are significantly more vulnerable than adults to air pollution. Even if you consider as a short-term health effects or a long-term health effects, to put in a very simple words, or as a physiologist and with my point of view, firstly, it's because of the developing lungs which are more sensitive, because the alveolar development it continues till the adolescence, and exposure to these air pollutants during this time can impair the lung growth. It can definitely damage the structural tissues, and the lung functions what we take in terms of or measure in terms of FEV1 FVC, it reduces the lung function capacity reduces, and this overall it's going to reduce the peak lung capacity in adulthood. It is going to increase this risk for the diseases like asthma and COPD. And secondly, it's because of the higher respiratory rate. The children, they breathe at more air per kg of their body weight than adults. So this means that they are going to inhale the more pollutants relative to their size, especially when they are playing outdoors. And thirdly, it's because of the immature immune system where the child immune defense are still developing, and this makes them more susceptible for respiratory infections, airway inflammations, as well as the allergic sensitization. And more commonly, what we see is these children are very closer to the ground. That means many pollutants, maybe especially the heavier ones like ozone or the lead, they get more concentrated near the grounded level where children they play, they crawl, they breathe, and this is again going to increase their exposure to these pollutants. And also their longer lifetime exposure, that is, suppose if they are exposed to all these early in their life, means this is going to add on as a cumulative effect across their lifespan. And early damage from air pollution often doesn't reverse, we say. And along with this, even the indoor air pollutants or the outward exposure of the air, these both dual exposures are really harmful. And so I can say that children are like more vulnerable than adults to this air pollution.
Brilliantly put, ma'am. Okay. See, they are the front lines. They are our future. Okay. Definitely, we when they are getting affected, our measures should be designed proactively so that they are protected. We'll discuss about measures how to combat. So I would request Dr. Anke to give a comment quickly on how effective have government interventions like AQI monitoring, odd even schemes, and GRAP have been so far, and what is their impact so far?
So first, let us understand each and everything in laboratorily. AQI monitoring, that is air quality index. You have very beautifully explained what is air quality index, how it is being measured, and what are the different gradations. So it is a measurement tool, reporting, warning system to the public and the government. That is what is the air pollution at a particular time. Now, we have seen Delhi has used the system of odd even scheme, that is using certain restricting private vehicles by their plate numbers, which is odd or even. See when the pollution is high, allowing some particular vehicle numbers on particular day and the rest on the other day. GRAP full form is Graded Response Action Plan. It has been used in Delhi from various grading from 0 to up to 4 because it shows that what action has to be taken collectively to reduce pollution if your AQI level is to a certain level. It is not only one thing. The measures include restrictions on vehicles, constructions, industrial activity. So if I make a conclusion of all those things that has happened, what are the limitations there? So the major limitations is that these interventions help, but none of their by own are sufficient because they need a combined effort. So timing is very important, enforcement is important, and coordination is very important that how they are being implemented at various sectors. Now, AQI monitoring is a very important system in alerting you. It is a very crucial because if you don't know the air quality index, you would not able to take any kind of intervention. So it is a good alert system. Structural changes like clean vehicle fuels control and addressing the agricultural burning and urban planning. So basically, isolated tools will not work. The combined tools will work.
So Ankit bhai, please adjust your network because it is slightly unstable, and whenever you are speaking, it is coming as a crack. So please ensure that the other devices, if at all logged in, you please ensure that your Wi-Fi is not being accessed by others in your surroundings. That's one request. But otherwise, you have placed very brilliantly. Policy is definitely one side, but economics and long-term burden matter equally. And then now, can I ask Dr. Tira, what is the long-term health cost burden due to air pollution in India? Is there any numbers, visible numbers?
Sir, according to some estimates, in For India, they're saying that 8.5% GDP is lost per annum in healthcare cost attributable to air pollution. So when we're talking about healthcare expenditures, it can be healthcare expenditures which come up when in terms of chronic healthcare, chronic caring for the sick people, acute care, and also in terms of persons' poor productivity, of somebody who's not able to go to work because they're not well or fit to go to work anymore because of their lung issues, and also premature deaths. So basically, Dali's lost. So this is what we talk in terms of, and they are saying that it mounts up to 8.5% of Indian GDP loss annually. And 2019 estimates are that 1.67 million deaths have been attributable to air pollution. Now, the thing is, this might still be an underrepresentation because, I have never seen on any death certificate that the cause of death is air pollution. We may still extrapolate, oh, this is COPD death or asthma exacerbation, and then we are getting this data from there, right? But we are not able to get the clear picture, because even like we are now learning that neurological diseases, cardiovascular diseases, lung cancers also, so we are not actually attributing all these to air pollution as of now.
So I was listening to one of our Kapil Iyer's, Dr. Kapil Iyer's podcast. So in that, I think Harshvardhan Puri has brilliantly put that whenever a kid or whenever a neonate takes birth, within first one day, this neonate in Delhi, if it happens to take birth in Delhi, our national capital, so in a government hospital, it means that, okay, this kid, within 24 hours, he would have smoked close to a pack of cigarettes. So that kind of worse air quality we are having in our country. Very unfortunate, but our fight, okay, towards a cleaner air, better air is definitely, one day it will achieve success. Thank you for that.
But why should we say that only someone who's born in the government center? Are we using
I'm telling about, probably in private sector, what will happen is they are in, well covered. Okay, probably. Okay, in air conditioned rooms where the HEPA filters are there, those kind of scenario, probably no. Okay, that's why. Otherwise, okay, if it is an unprotected setting, okay, and an average, a neonate will have a within one day, okay, will taken birth in national capital, she or he is consuming, okay, because of air pollution, the equal amount of pollution, okay, which results from 10 cigarettes burn. So that was I meant. Okay, and can I call upon Dr. J? See, what lessons can we borrow from global success stories in reducing the air pollution burden? Urban particularly.
Okay. So in the urban areas, how to reduce the burdens because of the air pollution? Already, Dr. Kirat and you presented nicely about the so many models in the Western world, mainly the Beijing model. They follow the United Nations Environment Program. So strict adherence of the laws. So industrial act or industrial regulations. Mainly, we have to remove all the industrial hazards. Those are the factories, industries, causing more and more air pollution. We have to remove all the things, and we have to make the clean green corridor for each and every one. And the of all the very severe hazardous factories which causing air pollution, and strict implementations and enforcements of the industrial law. And various factors plays a major role in we can control. See, Beijing they are doing so. Why we are not? Because of the strict implementation, enforcement, and the laws plays a major role. So here, Indian scenario. So we have to do a lot of things. India is No, we are highest populated country in the world. So country-wise, very small country, and we have a highly populated number one populated country. So economy plays a major role in that. So for that purposes, we have to do very no, the combined work from the policymakers and individual responsibilities, community level. So we have to work hard, and we can do that. We can achieve. There is no like Beijing model in India, in Delhi, and other areas. Definitely, we can do that. For that, so all corporations unite. We have to unite and do all the good things. So these things, we have to copy and borrow from the Western world, and we can improve our standard of living by improving the environmental health, environmental aspect of the prevention of air pollution, etc. Yeah.
So what Jay is mentioning is on war footage we have to implement, otherwise we'll succumb to it. So Renis bhai. Okay.
Yeah.
Coming to you, do you think the current air pollution, whatever we are facing, the crisis situation in India, is going to, you have slightly hinted, but again, I want to get more clarity from you. Is it going to affect even pregnant individuals? Is it going to affect kids? And then is it going to affect non-smokers, smokers, and future generations?
Yeah.
I think Renis bhai, okay, switch off your video and then speak so that your network will be better. You will be more audible. So, in the interest of time, Kirat, can you please take this question quickly? Unmute yourself.
Sir, we can wait for sir to come back online and we can ask him this question when he comes.
Yes, sir. Yeah. Renis bhai, now you speak. Now you speak because
I don't think he's connected still.
I'm sorry,
we can come back to this question. Let's move to the next question then.
Right. Okay. See, Kavana ma'am. Okay. So, what can physicians do at a community level to raise awareness about pollution-driven lung diseases?
Yes, sir. Physicians actually they can play a very crucial role at the community level, even though they are like quite occupied in their own surroundings or in the hospitals. They can raise the awareness about this air pollution related to this lung pathology. We say they are the frontline workers. Definitely, they are also the trusted voices in the public health system. By organizing community awareness programs, maybe the health education programs and the outreach programs, leveraging the local events with the by conducting the community campaigns and early detection and screening drives. Me being a physiologist, I do accompany the Department of Community Medicine and as well as the medicine department where we do conduct the free spirometry camps where we can detect the early COPD or asthma in asymptomatic or mildly symptomatic people and educate on how the chronic cough or breathlessness could be the pollution related. And as well as it's very important to identify the vulnerable groups who are like children, elderly, or those with chronic respiratory diseases and teach them on how to monitor the symptoms, use inhalers correctly, or avoid the triggering factors. And thirdly, if I have to say, like advocate with the local authorities, even though this is also been considered, it's like quite a difficult task for the physicians. But being with the interprofessional collaboration, we say nothing is like being impossible. It's like advocating for stricter enforcement for clean airways, engaging with the local welfare associations. And in the digital era, like use of media also plays a very important role here, like simplifying scientific about the pollution and lung health for the public, suggesting some protective behaviors like checking the AQI daily, wearing N95 masks, use of air purifiers at the home, on the school, and utilizing the WhatsApp group where many of us are active nowadays, the Facebook, Instagram, where we can share the infographics, short messages through the community WhatsApp groups, post the reminders about the AQI and all. And over all this, it's very important to have a model responsible behavior. That means to practice what we preach. And finally, definitely we need to collaborate and train the ASHA workers or the nurses, pharmacists, so to identify the pollution-related symptoms. Supporting the local campaigns, like saying no to crackers, say no to burning waste. By all these methods following, definitely physicians can play a very crucial role at the community levels.
So I just coined a term called PSR. Okay. So PSR means CSR, similar to CSR, corporate social responsibility. Similar to corporate social responsibility, we should also have physician social responsibility, as Dr. Kavana said very brilliantly. So we should try to engage in a lot of things from educating kids, attending schools, and monitoring their lung functions of kids and then adults. Some social responsibility towards traffic police, which we do see day in, day out. Okay, they're just swimming in the pollution. Okay, like that. So let's do some PSR activities and then bring some changes. Let me go to Dr. Ankit. Ankit bhai, should India adopt a very strict policies like as it gets adopted in Beijing and then US Clean Air Act, like that? Or what is your take from it?
Yes, definitely. If we see the US laws, they have a durable national legal structure. They have a clear health-based standards and a robust enforcement. So this can deliver to a large public health and economic benefits. So that's true. But just now, on a lighter note, as a tariff war is going on, and we are more relying on Make in India, so we should have our own laws because we have certain limitations also. And what are those? We are using more of biomass. We have open waste burning. We have agricultural stubble burning. We have huge informal sector. We have different governance capacity all across the India. So we are so much varied on that. So we want such a law to be enforced, but we have to see our local needs. So immediately what we can do or we can think of in that particular way is that obviously we need an official body who can look look for national standards which could be regulated regularly, and independent national regulator which has clear powers and strong state boards. That is important. There could be legally binding state implementation plans which could be there. There could have to be a robust standardized monitoring and public disclosure. That is very important, so that we develop a low cost censored networks, particularly in our context. We should have a mix of regulatory and market instrument. And most importantly, we need a regulatory mechanism, particularly to look after those crop burnings, those industrial corridors that has to be looked into. So yes, we need laws like Beijing and USA. But again, we have to see our local demands, local needs, and formulate accordingly.
Ankit, well, you have brilliantly put again. Okay, while I was listening to you, it just came into my mind. So that probably while giving an example, a builder has come to the municipal corporation authorities to build, probably imagine some 500 houses in probably 5 acre skyscraper kind of thing. Imagine. So then municipal corporation should give the permissions with probably at least 50% of the land should be developed into a thick forest.
Yes, definitely.
That kind of stringent laws should be there.
And
Otherwise,
this has to be uniform. And this has to be uniform all across.
This has to be uniform, right? And then, as you, I completely understand. You have said stringent laws. That means for everyone it applies. For every citizen of India, it is applicable. Right? I totally appreciate. Right, Kirat. Right. How reliable is our country air quality monitoring, and what improvements are needed?
Sir,
Yep.
AQI monitoring.
Yeah.
The problems with Indian AQI monitoring are.
I'll tell you one example. There was at one place in Hyderabad. Okay, it stopped functioning for days together. Okay, Pollution Control Board. It took a lot of time because this is displayed at many places in Hyderabad for public awareness. But once it stopped, functioning, no one bothered about it. So over to you, please.
So you were mentioning that in Hyderabad it is displaced at a lot of places. Over here, I have not seen it being displaced very often. I mean, hardly I see it displaced anywhere. When I want to check, I'll see it on my own phone. I encourage my patients to check AQI. Now, one of the things would be that the coverage of AQI, the monitoring stations, the density is not very, what should I say? It's not equally, placed. The rural areas, they have poorer coverage of AQI monitoring stations. Then, what AQI monitoring station, the quality or what level it is picking up? Is it picking up PM 2.5, PM 10? Is it able to pick up other values of other particular metals and particular gases it will test, right? This is one part. That is very technical. How they improve it, I would think we should leave it to the government, and this we should demand that they, make it better. That is one part. Other part is, even though I'm able to see what the air outside is like, how often are we only checking the AQIs indoor? If when I turn on my air purifier, that's the only time I get to know. We need to have more smaller and portable AQI monitors. Like, even the cars have AQI monitors now. But rooms and houses, we don't use AQI monitors as frequently. They should be there. Third, I feel that the visibility of AQI monitoring, it needs to be more and more visible. Only then it will mobilize the population to take action. For that, I feel outside schools, outside hospitals, and at fuel stations, where they display that petrol, this price, this rate today, diesel, this rate today, they should put up the AQI there. Because everyone is, I think everyone is very, very interested in what the fuel prices are. So when they look up there, they should also see the AQI. And more awareness in this manner is the only way people start looking it up before they move out. And it is going to take time for the mindset to shift, to understand that this is a very real threat. It is a slow, constant killer we are breathing every day.
I agree to every point you mentioned, Kirat. Let me ask Jayaraman, how can a healthcare professional partner with media to create a stronger voice? Okay, and Dr. Kavana's brilliant saying about physician social responsibility. Now, how can we tie up with the media to create more awareness? Jay, you are muted.
Oh, sorry. Media plays a major role to disseminate the knowledge across. So public awareness is the key. So without awareness, so we won't know. So what kind of knowledge we are going to get. So what purpose we are doing that. So media, including the private and public medias, print medias, TV, WhatsApp, all the social media, Twitter, LinkedIn. There are so many things. WhatsApp. These medias are playing a major role. So easy communication, easy way of understanding to the common layman, to the official levels. It reaches all the levels. So awareness is the key by which the media plays a major role in that. So we as physicians. So each and every day, we have to interact. We have to go to the studio, or if you request them, they will come to us to take the important day awareness program. We can do the Facebook Live about the healthy lung and healthy and happy life, etc., etc. So each and every day we have almost all the days. If we take the respiratory days and all, so we have TB day, pneumonia day, sleep day, COPD day, ILD day. Each and every day we have. So each and every day, not only the days. So we have a lot of awareness program in the TV. There is a special doctors program. So we have to do the strong message to the general public about the all good things about that. So we are all facing, as a respiratory physician, air pollution faces a major enemy, major threat to the humankind. So we have to talk to the media. Through media, we reach all the people in a very great numbers. So this way we can update. Media places, there is a major role. There is no doubt at all. We have to utilize thoroughly all the media, social media, TV, print, everything. Yeah.
We should also bring in the popular figures like chief ministers or health ministers and movie stars, and then we should collaborate with them. I'm sure Ankit is doing a lot of good job in Jaipur, right?
Yeah, celebrities involvement is very, very important, along with the ministers and doctors. Yeah, fully.
Reddy's bhai, okay. What practical interventions at individual level, community level, and policy levels are most effective in protecting our lung health?
So to whom you have actually posed this question?
Dr. Reddy.
I think there is a network issue from Dr. Reddy's. Okay, let me see if we can join later. I'll put the same question to him. Otherwise, I would love to. There are 1,500 plus logins. So it is a brilliant involvement from a lot of pulmonologists, physicians across India. So thank you each and everyone. There is a question, okay, from Sukhbinder Singh Sibia, Punjab. Okay, thanks, Dr. Vijay Chanan Chetty, for informative talk. The devastating link between escalating air pollution and cardiorespiratory health is fundamentally a public health crisis. Given the Chest Council of India authority, there is no organization better positioned to take the lead in this fight. Forming an NGO to move beyond this just treatment, CCI can spearhead a national campaign educating the communities on preventive measures and as essential for wealth of every Indian's lung. So it will also raise the level of CCI. Thank you so much. I think Uncle.
Yeah.
Right. Such a warm, lengthier message. Really, convey our CCI and then my personal best wishes and regards to Uncle. So, Dr. Kumar from Ranchi, he is stating that there are many renewable sources of energy, and India is still on the path of the shift. Say no to fossil fuels and yes to healthy air and environment. At the same time, reforestation and planting trees and adapting greens is small garden at every home will add a lot. Really, Dr. Kumar, really appreciate for your inputs, and thank you for active participation in CCI webinars. And here is Dr. Uday from Karnataka, Bengaluru, okay, which is got completely deforested. While we are discussing global and national challenges of air pollution, I would like to draw attention to the ground reality in many parts of India. In several places, people are continuously living with smoke and its complication without even realizing its impact on their health. For example, in Koppal, that industrialization is directly affecting not only people's lungs, but also agriculture. Interestingly, the local population worries more about crop loss than about their own respiratory health. This indicates a huge gap in awareness. People do not connect smoke exposure with long-term lung diseases. So I propose that we first start with awareness initiative that involves the youth. For example, a campaign like Spot the Smoke, where students and young volunteers can post photos and short reports of areas where smoke, whether from industries, burning waste, or domestic sources, is affecting communities at a large. Really wonderful suggestion, Dr. Budai. We really, circulate this. Thank you so much. And he is also commenting quickly, the second step should be verification and acknowledgement. A committee or a task force, which Dr. Ankit was clearly mentioning, so should ideally link with institutes or medical associations, can cross-check these reports on the ground. Finally, the third step should be solutions. Once validated, interventions can be directed either at the community level, that is changing habits such as crop burning, biomass fuel use, or at the industrial level, ensuring emission control, cleaner technology, and their strict enforcement of laws. So, in summary, first awareness, then notice, and finally take action. If we empower our communities to see the smoke, name it, and demand change, then really policy and preventive measures can follow. And thank you so much, Uday. We are really, proud. And he has written, good suggestions. We take it and we ensure that we will try to, whenever we are preparing a paper from this webinar, we will ensure that your ideas will be placed and then we'll quote your name as well. Thank you,
Dr.
Dr.
Vijay. Dr. Vijay, am I audible right now?
You are loud and clear, boss.
Sorry.
No
I've
problem.
logged in through another device. Sorry for keeping you waiting.
No issues.
Yeah. The question, first one which I heard was whether the pregnancy children, they all get involved by this bad air pollution. And I liked your quote, Hyderabad. That's right. Good, right? So it can involve pregnancy because the fine particulate matter, the PM 2.5, what we are talking about is basically group 1 carcinogen. And these PM 2.5 as well as PM 10 can cross the placenta and they can affect the mother as well as the fetus. The mother, it can affect by hypertension or reduced lung function, and they can have exacerbation of asthma and so on. And in a fetus, basically, they can have a preterm birth, low birth weight, impaired lung development, and reduced lung function in infancy. And that causes, you might have seen a lot of people, the young children coming up with recurrent respiratory infections and wheezing in their early childhood, probably due to this air pollution affected their lungs during pregnancy. And childhood, as you know, the lung growth can continue up to the late adolescence. So the pollution exposure in the early years of a child can have long-term impact. They can have impaired alveolar development or asthma, or they can have asthma, they can have respiratory infections, they can have poor exercise tolerance and school absenteeism. All these can be, we can attribute to 40% as per your percentage, in times of India, to this air pollution. And for non-smokers even, this will act as a passive smoking. And smokers, as you know, it's a deadly duo. The smoking along with air pollution, that will cause, they have a COPD progression, they will have frequent visits, they will have frequent exacerbations, they will have predisposition for lung cancers, etc., etc. That was the first question, I think, where I got lost from your webinar.
Yes, Dr. Renis, yeah. Right.
Thank you.
Next question is also, let me put it, because that was the last question before I was reading the comments. See, what are the various practical interventions that at an individual level, community level, or a policy levels are most effective in protecting the lung health?
Yeah, good one. That's an excellent one. I think by as an individual, we can monitor AQI or air quality index from different apps. Like I do have the Samir app within my phone, and I look before I go for exercise. I just look into it that, and it's today it's a 66 at Cochin, and maybe Delhi it may be 110 or 120. So that way we can keep indoors if the AQI is more, and we can either if you want to go out, then still you can use N95 mask. And from your Times of India news, I could make out like even the cloth mask may not defer the entry of this the particulate matter of 2.5. So better will be an N95 or FFP2 mask in polluted environments. And then we can look into the indoor air quality too. Each individual can have good ventilated homes. They can use the chimneys or the exhaust while cooking. They can have alternatives from the biomass, like they can shift to LPG or electric cooking, and no smoking areas. Anyway, if there is some smoker at home, that they have to go out and smoke, not inside. And then once you exercise or you have some body movements, then better you have it in a cleaner environment, or clean air should be there. And then you should have a balanced diet with antioxidants, as well as the vaccinations to prevent getting infections from this unhealthy environments. So that's the individual level. And community level, you have to, being the pulmonologist all around, we have to raise some awareness campaigns in the community. And we have to, as you were telling, you all were talking about promoting Go Green or greens, getting more tree planted or urban gardens or whatever. And then we have to reduce the sources of pollution by stopping the burning of this waste, especially plastic or the crops, or encourage the cycling, walking, exercises in the community. And that way you can have some health educations to the community level where you live in. And they should have excellent waste disposal schemes, or they shouldn't burn it off in the common community. And as far as the policy is concerned, we should have a clean energy transition. Maybe the old vehicles have to be crushed, and you have to move into more what you call low emission or electric ones. And inside the kitchen, you may have to move into more LPG or electricity oriented, or some cooking stoves which are clean cooking stoves. And then about the transport, we may have to depend on more public ones, and rather than each one using each vehicle, which doesn't have much stricter vehicular emission norms. Or we have to enforce, as a pulmonologist all around, we have to enforce some emission control standards. And your Times of India thing was excellent. We have to give the public the education about what it causes ultimately onto your lungs. No one think about the air they breathe. They think about the food or sleep. So, but that was a good eye opener for me too. And we have to have excellent tobacco control. I think higher taxations or strict bans in the public places. And we have to adhere to the national cessation programs in all the medical colleges. We do have it. And then a real-time quality management should be there with AQI alerts. Maybe in the common places in a town, or we get all public get to know what is this AQI and what is the value today and the day after tomorrow or tomorrow, and then they take real measures for that. And these people who are having some symptoms, they have to obviously have some screening programs or get into the healthcare for whenever they get the symptoms. That's all. Thank you for patiently listening.
Thank you so much. Such a elaborative and then very clean message you have given. Over to Dr. Kawana. I request everyone to limit in the interest of time to 60 seconds to your answer for each question, so that we can complete all the pre-designed flow by next 20 minutes. my request. And Dr. Kavana, how do you integrate environmental exposure history in your daily practice?
Yes, sir. So before I answer, I would like to just convey a message saying the message just now read by you, Uday ji, has conveyed me to convey you, sir. He's a third year medical student. He's so keen, interested, and he's so excited to listen from all the esteemed panelists. And he has conveyed his thank you note to all the panelists.
Yes, ma'am. Your 60 seconds starts now.
Yes, sir. So integrating environmental exposure history definitely in the daily practice is very crucial for all the healthcare professionals. This is very important because a comprehensive care is especially needed from the physicians, especially in case of air pollution exposure. And if I have to give a step-by-step approach, usually the physicians or the pulmonologists, they go with the initial assessment, wherein they go with asking the patients about their environmental exposure history, including where they live, they work, the time they spend the outdoors, and their proximity to the pollution sources, maybe the highways or the industrial sites. And secondly, exposure assessment tools, use of the standardized tools such as maybe some of the exposure history questionnaires, air quality index data, and as also the GIS mapping. And going with the physical examination and the diagnostic tests, performing the physical examination through a thorough attention to the signs of respiratory illness, and diagnostic tests including the inflammatory markers. And then the risk assessment and the counseling, where they assess the patient risk of adverse health effects from the air pollution exposure indices. And definitely the ongoing monitoring and the follow-up of the patients, where the patients are also encouraged to track their exposure to air pollution and report any changes or the concerns. And also the collaborating with the healthcare other professionals, where such as the primary care physicians, pulmonologists, environmental health specialists, to ensure the comprehensive care goes on in a stepwise manner.
Thank you so much, ma'am. So, Ankit Bhai, how do you see the industry, transport, and agriculture contributing to pollution burden? And what urgent policy shifts do you recommend quickly in 60 seconds? Unmute.
All these three sectors are important. That is industry, agriculture, and transport. In industry, we know that coal-based power plants are the largest source of sulfur dioxide and many other oxidants. So what could be the urgent policy shifts? Strict emission standards and enforcement so that it is reduced. We can give incentive if there is a fuel switch to natural gas, LPG, or electricity. We have to do the dust and the waste management also. So that needs to be enforced. Second important aspect is about the transport. Vehicles are the major source of nitrogen dioxide, carbon monoxide, and secondary particulate matter. So what could be the urgent policy shifts? Public transport expansion, use of metros, electric buses, vehicle electrifications. We are developing that model also in various cities, faster EV adoption, scrappage policies. Still a controversy you have seen in Delhi. But yes, if old vehicles emitting lot of pollution needs to be omitted from the roads, there has to be low emission zones. The food quality, the fuel quality and inspection has to be done. Regarding the agriculture shift, you can always have a residual management alternatives. That is, you can go with happy seedings, mulching, decomposers. There's a crop diversification incentive. If people are growing to pulses, millets, and maize, they can be given some incentives over that. We restrict the village levels bans on burning, and we have to reduce the livestock and agriculture ammonia reduction. So there are many things that can be contributed togetherly.
Yeah, thank you, Ankit Bhai. Really appreciate. Once I have seen a video where a government bus, that is for the namesake, it is an electric bus, but at the depot, what they are doing is they are burning a diesel generator and then, charging the bus. How foolish the people are. So that's why at every level, where we can combat air pollution, we can do a lot of things. Over to Dr. Kirat. What role does indoor air pollution, particularly this biomass cooking, which is one of the #1 cause of COPD in India, incense sticks, mosquito coils, and they play compared to outdoor air pollution? Quickly in 60 seconds.
Sir, we spend most of our time indoors. More than 90% of our time is spent indoors. So, even though the biomass, use of biomass fuel for cooking may be relevant to the, low income household. So the fact is, those people, for them, when we talk about biomass, they're spending a lot more time indoors, and they have an additional exposure to carbon monoxide, which would not be there in the other kind of incense infusion and using even perfume dispensers in mosquito coils. But then they come with their own set of problems. Mosquito coils, they are equivalent to smoking more than 100 cigarettes. I mean, and then extrapolate it further to first hand, second hand, third hand smoke. Wherever a mosquito coil has been, used, how much, for how many days the residue is going to be there in the environment. And it is continuous exposure. And because we are spending more than 90% of our times indoor, this is a very major concern.
So we have to check ourselves. That is a personal responsibility. We don't are getting exposed to this pollution source within.
Yes, we should use air purifiers, and we should have indoor plants.
Exactly.
All these can help. And we have to be most importantly, be conscious. Using upholstery which is treated is a source of volatile organic compounds. The paints which are used in the house, source of volatile organic compounds. The woodwork, the wood varnish, everything. We are basically living in closed spaces. We are insulating ourselves. We are not keeping much of, not proper ventilation, relying more and more on air conditioning. All these are increasing our exposure concentration.
I'll tell you, okay, there are people who put the air condition onto 18 or 19, 20 degrees centigrade and then put a blanket and then, and then sleep. That is completely ridiculous. Okay, there's a lot of energy we are wasting. Okay, these are all, the small things which can create a greater impact. Over to Jayaraman. Jayaraman, if you had to propose one urgent step to the government today, it is a great opportunity for you, and then we'll ensure that Modi ji will call you back. Please go ahead.
Yeah. One urgent step to government to stop air pollution means we have to implement the Clean Air Act. Clean Air Act is strictly implemented to all the regions by the various sectors, industrial sector. So we have to follow the rules and regulations very strictly. And the building sector. So we have to follow all the strict regulations in such a way that we would meticulously follow that. Any deviation from the law, we have to penalty. So daily penalty. So such a way that we have to implement it. And the Agriculture Act, unnecessary burning of crop and other things and all. We have to have the modified technologies to prevent unnecessary pollution. So law implementation is a very, very important need of the hour. So without law, without implementation, strictly, without any penalty, so very difficult. So we have to urge the government to Clean Air Act and implement it immediately.
Great. So, Rajesh Bhai, so we have discussed that the number one cause of COPD in India is not smoking, but it's probably indoor air pollution, particularly in rural houses. Your comments, how to combat it efficiently in both rural slums and then rural households and urban slums.
Yeah, I think I took some extra time last time. So I will just make it concise. For rural households, the priority should be the clean cooking fuels and stoves and the ventilation. And for urban slums, the focus should be on ventilation as well as the clean community kitchens and the part of waste management. I think the both require a kind of policy backup or community ownership to sustain those changes. And rest, I think I have mentioned about all the previous ones, in the previous question. Thank you very much.
I agree. See, there is a comment from Sumit, Dr. Sumit from Haryana. Okay, should mitigation of air pollution be on the public, on the states, on the central, or it should be on huge public-private partnership? The goal is to figure out which is the fastest way to reach at least good qualities of air quality. So that's what is nice thoughts, Dr. Sumit. It is not individual's responsibility. It is individual's responsibility plus everyone's as a nation. So we are suffering a lot. As Kirat directly mentioned, 8.5% of GDP is lost because of poor air quality, what we are breathing today. It is an immediate thing that we should ensure that stringent policies are enforced in India as well. So coming to quick last round of questions. So 30 seconds for each. What practical preventive measures can families adopt to protect themselves from polluted environments? Dr. Kavana ma'am, your time starts.
Yes, sir. So when we think of families, sir, families cannot take like the steps which are not practical or not affordable. Definitely families have to take some several practical, affordable, evidence-based steps so that at the individual level as well as at the household level, some of the preventive measures can be taken to tackle this air pollution. So planning some of the outdoor activities very smartly, like in the sense exercise, walk, or commute early morning or the late evening walks when pollution is lower, and except during the winter inversions, and avoiding high traffic roads or construction heavy areas, and choosing parks or green spaces or the indoor gyms when possible. And also to create the clean indoor air spaces where to improve the indoor air quality, avoid indoor smoky sources, and to consider the air purifiers. And we were talking about planting trees in and use of the indoor plants also, like snake plant. All those also helps in order to tackle this air pollution.
Thank you so much, ma'am. Thank you.
Yes.
Thank you so much.
Thank you,
Wonderful inputs. So, as a torchbearer, Dr. Ankit, okay, you have done, wonderful things. Your take on, how to form a very good associations for clean air policies, your inputs.
Medical associations
Medical
are important.
associations.
Medical associations are important because they contact various ministries. It could be health, environment, transport, energy. You have to make laws. You have to contact them, make a laws with the ministries for stronger air quality standards and enforcement. Secondly, we are able to make medical evidences. We can link pollution directly to disease burden and economic costs. So we can make the position papers and recommendations. That is important. And just we have made laws for anti-tobacco. We can push for laws for clean air legislation. Working as a medical community, you can train more doctors who can educate the community for the pollution risk and protective measures. You can always do awareness campaigns and you can disseminate data. So as an association, and particularly looking forward with our own association, CCI, which can very well take these initiatives to the next level in enforcement and creating certain laws.
Excellent, Dr. Ankit. So, Kirat, back to you. Could air pollution be as a hidden contributor to India's rising cancer burden, and then how to combat in very quick manner?
Sir, we have seen an increase in cancer numbers. We have seen an increase in air pollution level. And international Agency for Research on Cancer has already classified air pollution as a carcinogen. So we have enough evidence, and if you look online, to link air pollution with lung cancer, but not just lung cancer, but also other kinds of cancers as well. What needs to be done? Ultimately, the root cause of all evil is air pollution. We need to act on air pollution. Management of lung cancers is a separate thing. A series of on lung cancer already ongoing in CCI. So we'll leave that for that.
Thank you, Kirat. So, Jayaraman, what message that the lot of young doctors are watching us now? They want a very clear-cut message that what these young doctors and medical students can carry forward about this fight against air pollution.
Yeah. For the message to young doctors and the medical students, the knowledge about the air pollution, health hazards, you must know thoroughly. You will be one of the role model to others. So involve all the health talk and CME programs, and to take this subject as one of the important subject to discuss with your own colleagues and in your areas, whether NGOs and the non-medical peoples and all. So you have to communicate with the local languages, like whatever the areas you are living. So you have to spread the knowledge across the impact of air pollution in the negative aspect. You must. So this is a very powerful basis. You have to have the thorough implementations of the things. So you have to have a proper knowledge about which pollution causes these things and all. So young medical students, they have a good knowledge you have to gain and implement with a very cautious thing, because air pollution menace is one of the very great thing. It affects all the system, not only respiratory, cardiovascular, neurological, skin. There are a lot of system. It leads to very health hazards, morbidity and mortality. So we have to take care. Young doctors and medical students, you have to have thorough knowledge on the air pollution. Yeah.
So young doctors, please follow whatever Dr. Jayaraman said. So senior doctors who are listening to me, whenever you are framing any question papers, please ensure that air pollution is being covered, and then related aspects has to be mentioned in the final question paper. So I have leaked one question for exam going people. So coming to Renes Bhai.
Yeah.
So, can the technology like air purifiers, okay, or clean cooking stoves play a meaningful role in improving lung health? To be honest, I can turn my camera to my left. In my room, my consultation chamber, there are two air purifiers which are fit in, and they are working constantly. So over to you for the evidence-based learning.
Yeah, absolutely. It does play a meaningful role. As you have told, you have kept two. But the access, the affordability, and implementation should be the focus. You sitting at Apollo can have the affordability, but a rural guy cannot have two purifiers at his home. So, but still, it will reduce. Definitely, it will reduce the indoor particulate matter, especially PM 2.5 or dust or smoke or allergens. We can easily give to, recommend for high risk groups like asthmatic children or elderly or those who have COPD. It's definitely that they will improve their lung function, no doubt about that. But I told you the limitation, it's expensive, less accessible, and it only works indoors. Not we can't keep it outdoor and have two outside and one inside. So it doesn't address the outdoor exposure of pollution, and then it requires maintenance, filter changes, and all the battery workups and all will be going on. And regarding the newer stuffs with real-time AQI, we can empower the individuals to make informed choices, whether they have to be in indoors when the AQI is high, whether they have to use mask, whether they have to keep their windows shut. Those things can be taken up once we have the real-time AQI nearby. But that also, I told you, requires some smartphone or internet access. May not be universal in the rural areas, and the information alone may not lead to action unless the alternatives exist. No, and the clean cooking stoves you were talking about, that will drastically reduce the indoor smoke. No doubt about that. That will protect the women or children in rural households or even urban slums. And so my takeaway will be, when combined all these technologies, we protect the vulnerable in short term and build awareness for them and provide long-term sustainable solutions. Thank you very much, Dr. Vijay, for wonderful questions.
Thank you, Renes Bhai. Okay, see, all the beautiful things, great things, okay, they have to end. We can run this show for another 1 hour comfortably, but it's already 10 p.m. and we have exceeded at least 15 minutes of our regular time, conventional time of a webinar. I have to conclude before my concluding remarks. So one-liner punch statements from each one of you. So can I call upon first Dr. Kavana for your take-home message?
Yes, before I give the take-home message, I would like to thank Dr. Krishna sir for the invite and Narayan Pradeep sir also. And this webinar went on so lively and brilliantly coordinated. It's because of your coordination, sir. Thank you so much. And I thank all the panelists here too. To give a punch statement, as you said, sir, I would like to put in this way. Physicians are the public health multipliers. It's by educating, advocating, diagnosing early, and collaborating, physicians can have a powerful impact in reducing the pollution driven lung pathology, especially in underserved and vulnerable communities. Thank you,
Thanks,
sir. Thank you so much.
Right. Dr. Ankit.
We are purchasing water. We don't want our future generations to purchase air for survival. So please act now. And physicians are a very important key in that prospect. Thank you.
Kirat.
I think AQI needs to start featuring in our prescriptions. And when we write a diagnosis, COPD, we need to start writing query, ? Air pollution induced. We need to start asking our patients what area they're living in, and we need to ask them how the AQI is in their area so that they see it more regularly. And that's how we get people thinking, mobilizing. I mean, so much has been covered in the webinar. This is one thing I'd like to add.
Jay.
Yeah. Follow the rules and regulations, strict implementation of laws in the air pollution prevention, health hazards, etc. So for that, individual responsibility, community responsibility, society responsibility, and the government policy makers, they have to take into forward, and they have to do the combined work. So what should basis government policy to change? So we have to do the very urgent need of the hour. We have to minimize the air pollution to follow all the Beijing model, etc., etc. So anyway, somehow we have to cut down all the air pollution. Otherwise, we'll face a large consequence, health consequences, lot of problems. Yeah.
So result oriented. Anyhow, we have to cut it down. Dennis,
Yeah. What I feel is the clean air is right for all of us. And that should be the best gift we can give to our children and the younger generation, and even for our vulnerable patients, right? So that should be a right. The clean air should be their right to live. And I thank Dr. Krishna, Dr. Atri for getting me in, and also Dr. Vijay for wonderful, superb moderation, and all other co-panelists who have done their job well, it seems. Although, and I feel sorry for being out of the panelist discussion for 5 minutes or because of the glitches in my technology. Okay, because my phone as well as lab was working at the same time. So I thought like I will enter from the lab, but that was a wrong idea. Sorry. Yeah.
No issues. No issues. We thoroughly enjoyed your participation. We look forward. I'm sure this is your debut webinar from on behalf of CCI. We look forward to such eminent academicians in future as well. As we conclude this session on World Lung Day, one message resonates loud and very clear. The fight against air pollution is not an optional thing. It is existential. Awareness without action is the missed opportunity. On this World Lung Day, let's pledge to make every breath count. Ourselves, for our patients, and a lot of generations to come. There's a small story as a closing remark I want to tell you. See, this would have you all would have gone through in our childhood textbooks. An elderly man starts planting the seeds of mango tree. Okay, in his probably 80s or 90s kind of thing. A young fellow who is passing by, he sees and then asks, "What is the purpose? You are not going to live for next few years to eat the mango fruits which you are, planting today." He says wisely, "This is not for myself. This is for the generations to come. So that's why the fight which CCI is doing today is for the next generations. I'm sure in next few years we'll see a lot of change, and sincerely thank my panelists for making it so evidence-based, so practical inputs. Really appreciate each one of you. Sincerely thank mankind. Sincerely thank, appreciate close to around 1,500 logins for today's webinar. There are a lot of take-homes as mentioned. I would, as mentioned, okay, it is our right. Okay, it is not an optional thing. So with this, I close this webinar, and then next Thursday, definitely we look forward to meet you all again, see you all again with the next webinar, and that is the final series of lung cancer webinar series. And thank you so much. Good night.
Thank you, Vijay, for the wonderful moderation. So we learned a lot of things from all the panelists. Thank you very much, CCI. Thank you very much.